A randomized trial of protocol-based care for early septic shock.
Hey, this is Dr. K from my medical school, and today we're going to give an update on sepsis, talk about its definition, its diagnosis, as well as the management of sepsis. So what is sepsis? Well, sepsis is a very profound inflammatory response to an underlying infection. It leads to significant vasodilation, so your vessels dilate, leading to a drop in blood pressure. Also, because of the inflammatory response, you develop a procoagulant state. So you can develop microemboli that affect perfusion of your organs. Now, when talking about sepsis, we always have to mention SIRS. SIRS is the systemic inflammatory response syndrome. You need two criteria.
Detail 2. There are more than 750,000 cases of severe sepsis and septic shock in the United States each year. Most patients who presented with sepsis receive initial care in the emergency department, and the short-term mortality is 20% or more.
So really the main point I'd like to get to you today is there's a new paradigm for sepsis, and that is a sense of urgency. Now, sepsis is the leading cause of death in non-coronary care ICUs in this country, with mortality rates somewhere between 30 and 50%. In fact, from 2000...
Background. Patients with severe sepsis and septic shock mortality was markedly lower among those who were treated according to a 6-hour protocol of early goal-directed therapy, EGDT, in which intravenous fluids, vasopressors, inotropes, and blood transfusions were adjusted to reach central hemodynamic targets that among those receiving usual care.
It is essential that the 6 steps are carried out within 1 hour of diagnosis. The steps.
Methods. They randomly assign patients with septic shock to one of 3 groups for 6 hours of resuscitation. Protocol-based EGDT. Protocol-based standard therapy that did not require the placement of a central venous catheter, administration of inotropes, or blood transfusions. Usual care.
Tomorrow is World Sepsis Day. Sepsis is one of the leading causes of death in hospitals. A Bathurst professor will tonight be part of an international presentation to world experts about his finding on the disease. He says early detection is the key.
Outcomes. The 60-day in-hospital mortality for the combined protocol-based groups did not differ significantly from that in the usual care group, nor did mortality differ significantly when the groups were compared separately. There were also no significant differences in 90-day mortality or in the time to death up to 90 days and 1 year. The incidence of acute renal failure, as indicated by a new need for renal replacement therapy, was higher in the protocol-based standard therapy group. The rate of admission to the intensive care unit was higher in the protocol-based EGDT group than in the other 2 groups. Conclusions. In this multi-center randomized trial, we found no significant advantage with respect to mortality or morbidity of protocol-based resuscitation over bedside care that was provided according to the treating physician's judgment. We also found no significant benefit of the mandated use of central venous catheterization and central hemodynamic monitoring in all patients.
Medicine without research is just like navigating the oceans without a map. Everything that exists in intensive care or in hospitals only exists because of research. The only reason we can do ECGs, ventilate people, give them medications, make them live through major operations is only because people have done and continue to do research. It's the most exciting thing that anyone can do. Intensive care is an area which